Good morning. Hey everybody. So hopping in here for Wellness Wednesday, and I recognize it's Thursday. So we had a little bit of a crazy day yesterday, and I was not home long enough to hop in and share with you, but I couldn't wait till next week to share this little tip for our wellness with you guys. So I figured you wouldn't care if we hopped in a day late. Hey everybody. So okay, Wellness Wednesday today is about our health insurance story. So we don't have health insurance. And we haven't had health insurance in about 3.5 years. And we get asked about this all of the time. This is probably one of the most frequent questions David and I get when we start describing our scenario. So insurance is definitely a huge part of modern day wellness. So much of our wellness is dictated by insurance or affected by it. So I feel like this is a very appropriate topic for Wellness Wednesday because all of us are affected by it in some way. And deciding which insurance to go with and trying to not break the bank is a huge question for a lot of us. So anyway, huge part of today's wellness. So here's our story. About 4 years ago, I was changing jobs. So I was working a little bit farther away and had a job that opened up for me in a beautiful, miraculous way closer to home. And it was a job that I was passionate about and had the ability to affect the health of my home community where I was living. Huge. And so I was so excited about this job opening up, but we came to a screeching halt when we realized I would be working part-time, and this job did not provide health insurance benefits for part-time employees. Prior to that, I had been carrying the insurance for our family. And this is the unfortunate part of our modern day system, is that so many people are in bondage to health insurance. And it's unfortunate. It's so unfortunate. It's a reality. It's the way it is. And several of us can't get out of that. But we were not meant to be tithing to the healthcare system. That was not God's design at all. Yet so many of us are stuck in jobs that we hate and that are taking a toll on us solely because we want health insurance coverage. That's not how it was intended to be. It's the reality. We're kind of stuck there, but it's not how it was meant to be. So we did not want insurance to stand in the way of our calling. And that's when we got interested, side note, in essential oils and Young Living, because I was like, we're not going to have insurance, so it's not going to be free to go to the pediatrician every other month like we had been on this like revolving door schedule. I've got to find something else to keep us healthy. And that's when this whole Young Living world opened up for us. Okay, side note. So through this process of trying to figure out health insurance and do we take this job that's a calling or not, we had godly counsel from a couple of men that we deeply respected. And through that counsel, we found Samaritan Ministries. And we have been super satisfied with Samaritan Ministries for 4 years. Wholehearted, full support of Samaritan Ministries. So let me tell you what it is. It is not health insurance. So we still are self-pay wherever we go, and we do not have health insurance as you and I would know it today. We're part of a Christian sharing organization. And we love this model because we feel like it brings us back to God's design and acts of the church taking care of the church, and that's what this model provides for us. So there are 3 organizations that are Christian sharing organizations that exist in our country. You might have heard of MediShare before. That's one that's a sister company to Samaritan. And these 3 organizations are exempt from the tax penalty for not having health insurance. So we are not penalized on our taxes by being a participant with Samaritan Ministries. So we pay our premium, if you want to even call that. We write out a check every single month and we send it directly to another Christian family that is participating in Samaritan that has a medical need. So we get an email or something in the mail that says, okay, your share this month needs to be written to so-and-so family in Kansas because their son had a motorcycle accident. Or your check this month needs to be written to this family in Michigan because they just had a premature baby, or your check needs to go to this Christian family in California because the wife was just treated for breast cancer. So these are real people with real needs that we are connected with, and we give our monthly premium, if you will, to that family directly to help them with their medical bills. It is so rewarding to be a part of it. We're encouraged to pray for the family, to send a note, and just really connect with another believing family. Then, if we have a need, our family has a medical need that exceeds $300, that need will be fully covered by other families in the organization. Since when? Okay, think about how insurance typically works. You have a huge high premium and a huge high deductible. So you're basically paying a lot of money just to pay a lot of money if you have to use your insurance, right? That's how it works. And everybody wastes so much money because of insurance. So we pay, sorry, I have a hair in my face. we pay to other families directly each month. And then if we have a need that qualifies, $300 is all that's going to come out of our pocket. The rest of it will be shared by other Christian families. Amazing and phenomenal. So if you have to have an unexpected surgery, or you have an injury, or you have a heart attack or stroke, or you have an ER visit, or you have a new diagnosis, that's going to be covered by other families, and your out-of-pocket cost is $300. We actually had to use Samaritan Ministries and this process a couple of years ago when I had an ER visit thinking I was having a heart attack, just a little bit of anxiety from life happening, which was kind of sad about all that. But I had to utilize the ER system, and we were self-pay. And this is where we're going to check out if this really does work. And so I told them at the registration, we're self-pay. We assume the full responsibility for our medical bills. We tried to negotiate. The company actually helped to negotiate the bills with us. And then the rest of the bills were covered by other families. It was beautiful and amazing. In fact, when we started receiving cards in the mail from these people we don't know, and they had checks written out to our family that we could apply towards our medical bills, I sat and cried one day as we had these cards out on our kitchen table, overwhelmed with the generosity and care and concern from these other families that were reaching out to what our needs were. It was beautiful. And then each month, it is a true pleasure and an honor to send our check to another family. Here's another thing that I love. I don't like sending my check when I used to be in part of the corporate world, sending my insurance check to a corporate company that is going to use that money to fund practices that I deem as unethical. I don't want my money helping to fund abortions. I don't want my money helping to do things that I have a moral and ethical disagreement with. So how cool to now be able to send our money to another Christian family. Okay, sorry, I had a little quick phone call there. How cool to be able to send our money to another Christian family that has a true need. So there are a few things that are not covered, and let me tell you what we do about these. Preventative treatments are not covered. So if you need to go to the doctor for prevention, or you need a mammogram, or you need a colonoscopy, something like that, those are not going to be covered under Samaritan. Your annual visits or well child visits are not covered, so you're going to pay self-pay out of pocket for those, and I'll tell you in a minute what we do for that. Your prescriptions are not covered. So we have found an app called Good RX app, and it will search for prescriptions in your area and give you coupon codes if you're paying with cash. We have saved a ton of money on prescriptions with the Good RX app. Any of your doctor's visits are not covered. Your dental insurance is not covered. So we found a very simple dental plan through our local dental provider, which is great to use. Vision is not covered either. And then some pre-existing conditions are not covered. So before you freak out, you're like, that's a whole lot. Let me tell you, it actually works out to be beautiful. So one, we're healthier. So we don't have to access the healthcare system as much, and that's the goal. Take responsibility for your own health, use what God has provided, the oils, the diet, the exercise, all of those lifestyle things, and you won't have to need as much health insurance. That's the goal. It's brilliant. But we can shop around. We're not limited by a certain provider and a certain network. So we call places for if my son needed glasses. I knew he needed glasses. So I just started calling around to vision providers. How much is a screening for an elementary student? And found the best price, the best deal, and that's where we went. And we tell people we're self-pay, so a lot of doctors have a self-pay schedule. Here in town, those of you who are local, Dr. Avery has a wonderful affordable self-pay schedule if we need to go to the doctor, and we just pay cash for that. So we save monthly. We put a little bit of our check each month into a medical savings account, and that way if we have to access it for something at a doctor's visit or whatever, we can just draw from that account, and it's not a huge loss to us personally. It's worked out beautifully, and in all honesty, it has saved us a ton of money, a ton. So our results is that in 3.5 years, we're healthier than ever before, which what a concept. When you take responsibility for your own health insurance, you end up being healthier. Guys, when I had corporate health insurance, I was like, why do I need to be healthy? They're going to cover my medical cost. Why do I need to even worry about it? It didn't even cross my mind to take responsibility for my own health until we were responsible for our medical bills. What a concept, guys. It is so rewarding to be able to send our money to another family and then to receive that money in return should we need it. And we just feel very fulfilled and like we are doing what God is asking us to do. One other thing I forgot to mention is you do have to be a Christian to be a part of this. You have to be able to write out your testimony. And you do have to be plugged into a church and have a pastor sign off on some of your lifestyle statements. So just part of their rules to being a part of it. No problem here for us. So I hope that's helpful. If you guys have questions about it, David and I would love to answer your questions. This has been a huge discovery for us and a huge part of our wellness story, and it has saved us a ton of money, and we're getting to contribute to other Christians like we believe the biblical model should be. So it's not for everybody, but I know that it can be for a lot more of you an answer that God could provide for you. So hope this is helpful, and thanks for tuning in for Wellness Wednesday on this Thursday. Have a super rest of the day. Bye-bye.